So I wanted to thank you so much, both Dr. Gilman and Dr. Katz, for joining this amazing group of teachers tonight. You're exactly the voices that they needed to hear during this especially tough time. I mean, it's been tough since March, but it's feeling especially tough now. So, my first question for Dr. Katz and then Dr. Gilman or Dr. Cleavon, uh, what's your biggest takeaway from what you heard tonight from the teachers?
So yeah, I think that one of the things that I heard, and it was both in what was shared and also in the chat, is I think the degree to which teachers are really craving community, and that the circumstances that we're in is incredibly hard to feel like you have that. And then when you turn around and you see major outlets, you see the paper of record, you see trusted figures in the media, essentially telling you that you're not doing your job when you know that you've been doing your job for the past 9 months, but that there is a serious and important question about whether or not the building that you typically do your job in is a safe place to be. um, I think it heightens the isolation.
Yeah.
And this is a job where the sort of the historical literature on teaching says that one of the most difficult things for teachers is the tendency towards feeling isolated from your peers. You shut the door, you're there with your students, and it's that enclosed environment. um, but I think teachers do crave community and they seek it out, and it has been very hard, very hard to do that during the pandemic. And as people were saying, um, you know, in the chat, it seems like you turn on the news, you read the newspaper, you listen to conversations that people are having, and it all sounds as if you're not anywhere near good enough because you're concerned about the health implications of being indoors for 6 hours a day in contact with dozens of other people for hours at a time during a pandemic of a respiratory virus. So I think that need for community drove a lot of the conversation tonight.
I agree. And thank you. Yeah, I as a teacher right now, I feel that. And I think what fuels us are those little side conversations that you have in the hallway in between class, and we don't have that. So I think this experience tonight was akin to that, virtually at least. So Dr. Gilman, what are your biggest takeaways from the discussion?
Yeah, one thing I've heard repeatedly from teachers across the US is that they're concerned and they're scared and they're not being heard. They're being told that children are not transmitting the COVID-19. However, a lot of their colleagues are getting ill in schools. They are being told to go back into a classroom without the proper PPE. In many cases, they have to provide their own PPE, which is pretty inadequate. In certain conditions, there are people who have diabetes, like type 1 diabetes, who are in their 20s. And being told that they can't teach from home, which is, which is inhumane because you have a comorbidity and you're going to be exposed to children who transmit the disease. Let's be honest. Let's kind of be honest here, and let's not lie about things. Kids have been transmitting viruses for for years. If you're a teacher and you've taught in a classroom prior to COVID, you know that if a child has the flu or has anything else, it spreads all around the classroom. Now in 2020, during the pandemic, we are being told that kids do not transmit a deadly, a deadly, a deadly disease. I mean, it's it's just not being honest.
Well, as Dr. Katz so astutely noted, when you walk into a classroom, it's like an automatic airborne disease shield because learning is so powerful, right? And so like I just feel like right now this is kind of a self-help group for me because I have been really since March and April, really February, because my mom was reading a lot about the disease back then. I've been really loud about this is not safe to be in a classroom. And I remember in the beginning of March, a couple other teachers and I were talking about it, and everyone was like, you are just being crazy. And then 2 weeks later, I'm like, were we? Because now school's shut down. And so I've been loud about this since March. I've made some friends about it. They'll come back to me when they realize I was right later. And for me, I appreciate the two of you so much because I've been kind of like wading through all those think pieces and articles about how safe it is. And then I found my way to your Twitter feeds and writing to realize, and it wasn't that it wasn't like confirmation bias. It was that like, I was looking for the hard evidence to corroborate what I was realizing. I would love to be I would love to think it was safe and then just say it's safe. But I appreciate the two of you being the voices of reason right now. And there's others as well, but you two stand out a lot. So this is my second question. What are the stories that should be written about school right now and school safety that are not being written?
I think one of the things that needs to be written, and I guess for everything that needs to be written, maybe it has been written, but it needs to be written more. So for example, Rachel Cohen's piece exploring all of the ins and outs on what the research actually says about COVID-19 and both children and school settings. We need people to actually poke through the dominant narrative in the press to the complexity, and not necessarily to draw the absolute definitive statement, no, school is not safe, but to draw the statement, you can't say it is safe based on these data. This is insufficient. That is a big statement. Upon which are you basing that statement? So I think that's one thing that needs to be told. But I also think that we really. So the second thing that also I think needs to be told is to really get down and talk about the children and the families who are being used in the media as the reason why school buildings must be open, and to put their perspective forward, because huge percentages of them, at a minimum, have extraordinary doubts about whether or not the safety narrative is true or not. They are used to being lied to. They are used to their schools being neglected by state and local officials. And over and over again, when people survey it, they find out that they are predominantly skeptical,
yes,
of the school safety narrative. And I really think that their stories need to be centered, because if there's that lack of trust on that level, then what's really going on is people other than those families, other than the African American and Latinx families in this city especially, are being used by other people to justify a specific narrative. And I think the third thing, because I always go in threes, the third thing that we really do need to write about and to talk about is how teachers are teaching. There's a great historical book by education researcher Cuban called How Teachers Taught, and it's a real it is an in-depth survey of actual pedagogical practices in classrooms over the course of a century, going beyond the sort of dominant narratives about this kind of teaching dominates this kind of, but actually looking at what practices are. Much the same way that that what is going on with our healthcare professionals is not being made visible.
mm-hmm.
to a public that is not taking this disease seriously. I don't think that what teachers are doing to try to provide a quality education for students um, is being talked about enough. It, with the understanding that we all want to be able to do better, we would all like to be able
Yes.
to teach the way that we were teaching a year ago. But what have we been doing to make the best of a situation? Because I guarantee you that even if everybody just shoved everybody back into school 5 days a week, um, with the mitigation strategies that would be necessary to make that even vaguely possible, not that it really is possible, but even vaguely possible, it wouldn't be what we were doing a year ago.
No, not at all.
So how are kids being taught? We're not talking about that.
No, we're not. I am, but I wrote about it, a 13-part series last spring. But we're doing some really inventive stuff. I mean, I'm a little biased because I'm a teacher, but we are, and we're learning as we go, and we're being really humble about it. And that there's no stories about that. So I agree with all three of your points. So Dr. Gilman, what are the stories that, I mean, and I guess I should have rephrased it differently. There are articles being written about this, but they aren't the ones that you're seeing a lot of. So what articles do you want to see more of, Dr. Gilman, about this current crisis that we're not seeing as much?
Yeah, I want people to be honest with the American people. In March, at the beginning of the pandemic in New York, before schools were closed, a week prior to that, I began seeing patients in the emergency room that were severely sick. I pulled my kids out of school earlier. I told my fiance, I'm like, yo, we got to get our kids out of school because there's a deadly virus here. And I pulled them out. A week afterwards, schools closed. And so, look, I know how this virus is spread. It's ridiculous to think that you can open up a school and then close it and then, oh no, I apologize, have in-person learning, remote learning, and then go back to a hybrid and then back to remote learning again and think that the virus is not being spread. Since being out here, the school here has tried that. They've tried a hybrid and then they tried a remote learning and now they're closed till I believe January. And my kids are just at home because going back and forth to school is very hard to learn like that. And I think the other important point is just having transparency and trust. Schools are not being honest with the outbreak, and we deserve to know as parents and as teachers if there is an outbreak in our school and who is affected.
I've been really alone with it, and I've been looking for like-minded people. Even some teachers have been that I know have been in denial too, and they were kind of acting like I was being crazy about saying that school needed to be shut down. So having your voices has been so helpful to me. So just having this in a way, this conversation was like selfish for me because it's just being able to see your faces and it's not an issue of confirmation bias. It's that there are just it's just like how climate change is an inconvenient truth. So is the global pandemic. It is just an inconvenient truth that the best way to mitigate this is to stay home if you can, wear a mask, wear the proper mask, not the bandanas like they were saying in March. We all were wondering how could that be the right way to protect yourself. And so I just really appreciate the two of you. It is a battle because you're battling so much disinformation, and you're also battling people who don't want to face the hard truths right now because they really suck, right? And so I just really, really appreciate you both. And it's fun to, read your tweets, but it's even better to, well, it's not, I wouldn't say it's fun to read the tweets because it's like really depressing information and hard truths, but it's been really enlightening and helpful. And I know that as Vicki was saying, there's a lot of teachers and also medical professionals right now who are being silenced. So having your voices, you're giving voice to those who don't have voices right now. So I really, really appreciate that.
One of the problems I'm seeing is that the people who are dictating policy are not the people who are actually interacting and on the front lines. We are we are working in the ER. You are teaching. You have a high exposure to this virus, and we're being told that everything is okay. There are 280,000 people who are dead right now. 75,000 on top of that. Excess. They're upwards of 2,500 a day, and people are saying schools are safe. Like, kidding me? I just can't. Like, every day I wake up and I'm like, is this reality? And it's very frustrating to be in a hospital and to be intubating 20-year-olds, 30-year-olds, and to have a full ER with patients. And I drive past the gym and I drive past a restaurant packed with people.
God, I don't know how you do that. I don't know how you do that.
And to be told that schools are safe is kind of the same thing. I'm like, absolutely not. Like, let's just keep it real. Let's keep it honest with the American public.
And that's another part of the whole conversation where, people were trying to hold out, oh, they're doing it in this place and it's being safe. Oh, they've done it in this place and it's safe. And none of those conversations, well, they're very quick to assume that the first reports that things are safe mean that they're safe. But the other thing is, are we incapable then of talking about what happened? If it is in fact safe in that locale, what did they do to make it safe? We had an education journalist, tweeting sarcastically about Europe. Oh, Europe managed to do it. Why can they do it and we can't? It was like, if we're going to even try to have a conversation about how school might be able to be safe, it should come loaded with what are all of the enabling conditions. And it really surprises me that we keep listening to economists telling us that these things are safe when they haven't even bothered to do a multivariate regression analysis on any of these factors. And I know they know how to do it. Their field invented that kind of analysis. So frustrating.
There's possible reason why they're not, right? And I think it does go back to the fact that they're not the one. I have a lot of people, it feels like when they're telling LeBron to go and just dribble, right? It's like, go teach. And that's kind of been the conversations I've been having with certain people. And I just don't engage in them anymore because I'm not going to wait.
Just tell LeBron to go just dribble. I've heard the man speak. It's like, set the basketball talent aside and you still have somebody who's pretty gosh darn brilliant there. So
right.
The audacity.
Well, they just really want, and I think it goes back to just like, what is school to people? School means, and that's what Dr. Katz was saying, right? Like, school means we're okay. So it's like, school is happening, we're fine. And then I'm saying things like, but it's not. And everyone's like, shut up. School is fine. And people don't want to talk to me right now, but you two will. So I feel like I'm in good company.
How many school officials are on ventilators right now around the country?
I don't know. Are there a lot?
They're hospitalized. We don't have that information. And by the time we hear that, it's going to be 3 weeks from now or something like that.
And I know that you've been doing some really powerful work this whole time, highlighting the lives lost to raise awareness that this disease can get to anyone. So I'd love for you to speak to that.
Yeah, so I think it's very important for children, especially in the school, to have on masks. They are vectors of the disease. They will get it and spread it to others. It's true that kids are less likely to die from the disease, but that doesn't mean that they won't have to be intubated. They won't have long-term effects of the disease. I've been posting about young kids who have died from this virus on Twitter. I have plenty of threads about that. And it really began with a few kids. One of them was a son of a ER tech who came home and brought the virus to his child, and then he ended up dying. And we've heard this over and over again throughout the year. And I have a thread on all the children who have passed away from the virus. But it's really hard to get that info. It's not really out there. So what's actually pretty interesting here is the people I'm seeing here in the ER, they've done everything right. They've had on the mask, but they drop their guard and they go to a birthday party, or they have like an in-home gathering, and then they end up getting very critically ill. So I've seen that happen a few times.
That's so sad, because and that's just how powerful the disease is. You let your guard down once, and the disease doesn't know that, doesn't say, well, I'll spare you because 98% of the time you've been good. Yeah, the history teacher in me is thinking about how we as a country are going to reckon with this, and how we're going to not memorialize it, but we need to do something to remember these lives, because we can't forget this. So
I get up every, so the first thing I do early in the morning is I have a cup of coffee and I scroll through Google and I look at the people who have died and I try to find them, and then I post them on Twitter as a sort of like as an honor, and honor to them, and to share with the world that people are dying, and I put a face to it.
I appreciate that, and I think that's really helpful, and it's just honoring them, because like you've been saying, it's a war, and these are dead, and it didn't have to be this way.
Right.
So shifting gears a bit, we're talking about masks, but then there's also this issue of teachers dealing with just unacceptable conditions, including their colleagues not wearing masks, among all these other issues. Dr. Katz, we're seeing, and you were talking about this tonight, and the numbers you were using were freaking me out. We're seeing a potential mass exodus in the field.
Right, and I want to emphasize what I said tonight is that it's not materializing yet in visible ways. We're not seeing great waves of announcements of advertised teacher positions that need to be filled now. We're not necessarily seeing people revealing the survey data that they intend to retire, but it is very clear that almost any time that we kind of shut the door and we give people an assurance of privacy, that a lot of people have this in their mind, that a lot of people are basically saying, if I can manage it, this is the year that I retire. So there's a potential, just as we see that people don't always trust to share their views openly in open platforms. My intuition says that we may see that materialize yet this year. And the simple fact of the matter is that in a typical year, we are licensing and hiring about 200,000 new teachers every year, because this is a high turnover profession within the first 5 years. So there is a pretty much a steady need. We also know that at the same time, over the past 10 years, there has been significant decrease in enrollment in teacher preparation programs. That's a nationwide phenomenon. Every state has pretty much reported significant drop-off, sometimes in excess of 30-40% of people seeking teaching licenses. So it would not take a significantly larger than normal wave of retirements to put us into some real, honest to goodness teacher shortages. For people who are considering whether they want to go into the teaching field, the part of the news is vaccines are coming. There is eventually an end to these current conditions, and schools are going to need teachers.
That's alarming, and let's just hope for the best, and that everyone takes the vaccine and get back some sort of semblance of normalcy, but fix what's broken. Because I think also, like, the inequities both in education, and then also just the inequities in our healthcare system, and the people who are getting sick the most, it's not a coincidence, the communities in which they are living. So
the problem that's happening now is there are excess deaths from March until July. There were 75,000 excess people. On top of that, 200 or whatever died. From July until January, it's probably going to be 125,000 excess on top of the COVID deaths. So I think in total there'll probably be 500,000. But people are not talking about that, right? It's a political thing. I try to put it out there, and everyone keeps on clinging to the 280,000. I'm like, no, 280,000 plus 75,000 plus the excess that's going to happen again. So yeah.
280,000 should also be terrifying on its own.
I know, it's crazy. It's insane.
Yeah. There was a really powerful but disturbing graphic of basically like how many people died on 9/11 and then how many people died on Tuesday and last Thursday. What advice do you have for teachers right now when their students ask them about COVID and safety?
Yeah, this is not very complicated. We've been having this kind of talk over and over and over again. It's the same points, and for whatever reason, it's not getting through to people. So it's always the same points, right? It's always you want to have on a mask, you want to socially distance, you want to avoid indoors, you want to avoid large crowds. If you're going to go grocery shopping, do it at off hours. You don't want people inside of your house. There's a lot of layers to this. It's not just one thing, but it's everything. I am a bit hopeful, at times too with that, but we all just have to survive until the vaccine, and we have to do our part and shelter in place and be as safe as possible until then.
Thank you so much for that. And Dr. Katz, what advice do you have for teachers right now?
Seek out your like-minded peers. Form the communities. On top of all of the excellent advice that is directly related to safety protocols from the virus that Dr. Gilman was just talking about, I think there's also a degree of safety in understanding that you are not alone, understanding that there are thousands upon thousands of individuals out there who are asking the same questions that you are, who are needing the same advice that you need, and who wish to follow the same precautions that you do. One of the things, again, that that I've talked about before is that it is very easy to feel isolated in schools. In some schools that are not, good functioning communities, there are people who want to perpetuate that because it makes it easier to control teachers. So when you are a member of a community, you are no longer a sole voice. You do not have to be a prophet crying out in the wilderness. That is not a necessity. So there are communities. You may have them within your building. You may find them in online formats. You may find them in professional organizations. You may find them in Twitter groups that organize and have chats for teachers. There are ways of nurturing community, because you should not feel that you have to advocate completely on your own. If you're in a unionized situation, that is supposed to come with the territory. Doesn't always, but it is supposed to come with the territory. It's built into the law. But we also heard tonight, even without union representation, there are aspects of national labor law that do protect people who speak together. So I will, to whatever degree that you can fight the inclination to believe that you are alone and to feel isolated, you should do that. You should do that, because that is part of the self-care package, but it is also part of the self-advocacy package.
That's such good advice. And my advice that I'll give is remember what we're doing this for. And we all went into education because we love teaching kids, whether they're kindergartners, I teach 11th graders, and I could wake up just like, annoyed about everything. And no matter what, even if none of my students turn on their cameras, the chat lights up and there's one kid that says something funny or really intelligent or both. And then I'm reminded again while I'm doing it. It's why I'm doing it. The touchstone is always the kids. So it sounds corny, but like, it's just the truth of teaching. We do it because we love the kids and seeing them come alive around stuff.